Two of them are the mRNA vaccines, Pfizer and Moderna, and more recently, the Johnson & Johnson vaccine, which used a different technology and method for vaccine preparations. Those are the three vaccines currently that I'm aware of that are authorized for use in the United States. The overwhelming opinion of the experts that we've talked to have said that the vaccines authorized in the United States are permissible to use, that none of them contain any pork products, and that they're all been made allowable for Muslims to consume. We've consulted with scholars in Islamic ethics and jurisprudence, and the majority opinion in the United States, nearly a consensus, is that getting the COVID vaccination while you're fasting does not break a fast. It does not have any nutritional value. It's an intramuscular injection. It is compatible with keeping a fast for Ramadan. We've been able to have conversations, sometimes very frank conversations between imams, physicians, public health experts, and others to say what needs to be done, what's our common message, what can we agree upon that our community needs to hear. And what I've seen personally, even in my own regional city and town, is that there's been really good communication, sometimes through message boards or social media, at the local level, where mosque leaders and nonprofit leaders are sharing their best practices, saying, well, this is how we're dealing with prayers in the mosque. This is how we're making sure that vulnerable parties are not coming together. This is how we're enforcing wearing masks and social distancing. This is how we're dealing with breaking the fast, where we would normally be having large groups, but now we're not. Maybe we'll do a drive-through iftar. This is how we're dealing with Eid. And we've even had really clever approaches like mosques requiring QR codes before entering, almost like a boarding pass, to make sure that people have already registered and they've agreed to the basic guidelines that facility and institution holds.